Vaginal candidiasis, also known as a yeast infection, is a common condition that many women experience at some point in their lives. It can be quite uncomfortable and sometimes even painful. This condition primarily affects the vagina and can cause significant discomfort, including itching, burning, and irritation. The root cause of this infection is an overgrowth of a fungus called Candida, specifically Candida albicans. Candida is a type of yeast that normally lives in small amounts in the vagina without causing any issues. The vagina maintains a natural balance of bacteria and yeast, which is crucial for its health. However, when this delicate balance is disrupted, it can lead to an overgrowth of Candida, resulting in an infection. This overgrowth is what causes the common symptoms of a yeast infection, such as itching, redness, and a thick white discharge. Statistically, most women will experience a yeast infection at least once in their lifetime, making it a widespread issue. It's important to note that yeast infections are not considered sexually transmitted infections, although they can be influenced by sexual activity. Sexual activity can sometimes lead to a yeast infection due to the friction and irritation it can cause to the vaginal area. This friction can disrupt the natural balance of the vaginal microbiome, making it easier for Candida to overgrow. Fortunately, yeast infections are easily treatable with antifungal medications, which can be prescribed by a healthcare provider or purchased over the counter. It's crucial to see a healthcare provider for an accurate diagnosis and appropriate treatment, especially if it's your first time experiencing these symptoms. Self-treating can be risky and may not be effective, as other conditions can mimic the symptoms of a yeast infection. Always seek professional advice to ensure proper care. Several factors can increase your risk of developing a yeast infection. Understanding these factors can help in preventing and managing the condition more effectively. One common cause is the use of antibiotics. These medications are often prescribed to treat bacterial infections. While antibiotics are effective against harmful bacteria, they can also kill off good bacteria in the vagina. This disruption in the natural balance can lead to an overgrowth of yeast. Another culprit is hormonal changes. These fluctuations can occur due to various reasons. Fluctuations in estrogen levels, such as during pregnancy, menstruation, or hormone therapy, can create an environment favorable for Candida overgrowth. This is why women often experience yeast infections during these times. Wearing tight-fitting or synthetic underwear can also contribute to yeast infections. These types of clothing restrict airflow. These fabrics trap moisture and heat, providing ideal conditions for yeast to thrive. It's important to choose breathable fabrics like cotton. Other factors include a weakened immune system, uncontrolled diabetes, and certain medications, such as corticosteroids. These conditions can compromise your body's ability to keep yeast growth in check. Douching, which disrupts the natural vaginal flora, is also discouraged. Maintaining the natural balance of bacteria in the vagina is crucial for preventing infections. Vaginal yeast infections typically cause a range of uncomfortable symptoms. These symptoms can vary in intensity and may affect daily activities. One of the most common symptoms is itching in the vaginal area. This itching can be persistent and may worsen at night or after certain activities. This itching can range from mild to severe, causing significant discomfort and irritation. Another common symptom is a thick, white, odorless discharge from the vagina. This discharge can be alarming but is a typical sign of a yeast infection. This discharge is often described as having a cottage cheese-like appearance, which can be quite distinctive. Some women may also experience a burning sensation, especially during urination or intercourse. This can make these activities particularly uncomfortable. Redness and swelling in the vulva, the outer part of the vagina, are also common signs of a yeast infection. This inflammation can lead to further discomfort. If you experience any of these symptoms, it's important to see your healthcare provider for a proper diagnosis. Early treatment can help alleviate symptoms and prevent complications. Section 4. Diagnosis and treatment. Diagnosing a yeast infection usually involves a pelvic exam and a review of your medical history. Your healthcare provider will examine your vagina and vulva for signs of infection. They may also take a sample of vaginal discharge to examine under a microscope. Treatment for vaginal candidiasis typically involves antifungal medications. These medications are available in various forms, including creams, ointments, tablets, and suppositories. Over-the-counter antifungal medications are available for mild infections. However, it's always best to consult with your healthcare provider before self-treating. They can recommend the most appropriate medication and dosage for your specific case. Section 5. Preventing future infections. Preventing yeast infections involves maintaining good hygiene and making healthy lifestyle choices. Wearing cotton underwear and loose-fitting clothing can help keep the vaginal area dry and reduce moisture. Avoiding douching and scented feminine products is crucial, as they can disrupt the natural vaginal balance. After swimming or exercising, change out of wet clothing promptly. Managing underlying medical conditions, such as diabetes, can also reduce the risk of recurrent yeast infections. Eating a balanced diet and maintaining a healthy weight are also beneficial. Section 6. Complications and when to see a doctor. While most yeast infections are easily treatable, complications can arise in some cases. If left untreated, a yeast infection can lead to a more severe infection of the vagina and surrounding tissues. In rare cases, recurrent yeast infections may be a sign of a weakened immune system. If you experience 4 or more yeast infections in a year, consult your healthcare provider to rule out any underlying conditions. It's important to see your healthcare provider if you experience any unusual vaginal discharge, pain, or discomfort. Self-treating can be risky, and delaying treatment can worsen symptoms.